Lecture number 6 Arachnida Page number 76 to 78.
6. Actia racemosa resembles the spiders in producing sleeplessness, restlessness, trembling and fear of death, and two, the evidences of nervousness are often in Actia, as in tarantula, reflex from uterine affections. The former has, after going to bed, jerking commencing on the side on which she is lying, compelling a change of position, nervous shuddering and nervous chills. Mentally, the two drugs differ. Actia causes nervousness. She feels as if the top of the head would fly off. Delirium with jumping from subject to subject. Sees strange objects. Great apprehensiveness as a concomitant of uterine irritation. Pains darting into the eyeball, though to the occiput. Feels grieved, troubled with sighing. Next day, tremulous joy, mirth, and playfulness. The head symptom of Actia is not quite the same as that of the Theridion, under which remedy the patient's head feels as if she would lift it off. Hyacinthus is useful in well-marked local jerkings and twitchings of groups of muscles. The patient is sleepless and nervous, or sobs and cries in sleep. The head falls from side to side. She laughs at everything in a silly manner, stuttering, mental excitement, talkativeness. She is nervous, suspicious, troublesome, but not maniacal. Causticum bears some resemblance in causing restless moving at night. She can find no quiet position. Intolerable uneasiness in the limbs in the evening. Anxiety and timidity in the evening. Trembling, uneasy at night. She wakes from a short sleep with anxiety which scarcely allows her to remain in one place for 10 minutes. She is obliged to turn her head involuntarily from one side to the other until exhausted she falls asleep. During sleep, she has frequent motions with her arms and legs. She jerks mostly the right side of the body. Convulsive motions of mouth and eyes, with sleeplessness and restlessness after repercussed eruptions. It is especially suitable to rheumatic patients, but to those who suffer from paretic affections, especially of one side of the face or of the tongue, the mouth, in consequence, is distorted. Belladonna produces a bodily inquietude as in chorea. The patient is obliged to move to and fro, especially to move the hands and feet. He cannot stay long in any position. The predominant jerking is backward almost. Although this may alternate with a forward bending. There is a boring of the head into the pillow, not mere rubbing against the pillow as in tarantula. Belladonna also has constrictions, hyperesthesia, mania with laughing, dancing, with crying, etc. But it is distinguished by the intensity of its symptoms. There are violent congestions, throbbing of the carotids, wild look, dilated pupils, and injected eyes. In hysterical states, Ignatia, though agreeing in many respects with the tarantula, has a well-defined individuality of its own. The nervous system is over-impressionable, incoordinate in function and contradictory in action. Incoordinate in function and contradictory in action. The patient is extremely susceptible to emotional influences. Fear and grief affect her seriously. The least contradiction offends. She is readily chagrined and is thus often reduced to grief and tears by the slightest cause. Her mental states, however, are not usually exhibited in violence and rage. On the contrary, she nurses her troubles in seclusion and silence, and broods over them until they prey upon her whole system. She thus grows more and more nervous and at the same time more and more weakened. The heart beats nervously with variable pulse. She frequently sighs heavily and deeply, suffers from goneness at the stomach, with qualmishness and flat taste in the mouth, feeling of a lump in the throat, swelling sympathetically with the intensity of her mental disturbances, sleeplessness or violent staring of the limbs, starting of the limbs, grief, fright, disappointed love, or some other similar cause may develop hysterical or choreic paroxysms. The moods change with wonderful rapidity. Now she laughs and jokes, then quickly she bursts into tears. Her manner becomes hurried, so that everything is performed hastily and hence imperfectly and awkwardly. She is afflicted with intense headaches. These are characterized by the predominance of a sensation of pressure. The pain goes to the eye, which feels as if pressed out, or to the root of the nose, or again it is confined to one small spot like a nail pressing, hence the name clavus hystericus. At the height of the paroxysm, she becomes restless and chilly, and often describes a peculiar perversion of vision. She sees fiery zigzags, then looking out of the line of vision. See Theridia. Finally, a profuse flow of colorless urine terminates the attack.
Colorless urine.
Huh?
Colorless urine.
White.